have two very special guests on our program today. These are two people who have been working tirelessly to help people overcome their addictions, whether it is alcoholism or addiction to narcotics or drugs. And they use a very special method called AcuDetox. Now, what is AcuDetox and how does it work and works so well? Let's ask our guests today. We have with us Dr. Michael Smith, who's often been hailed as the Archangel, and Suneel Vatsyayan, who heads NADA India. Dr. Smith, I start off with you first. What is it that brought you to this, towards de-addiction and helping people with this?
Well, I was working in a very large city hospital in New York. Every day I had to see about 40 people. They were noisy, they didn't want to be seen. And so we started doing this acupuncture, but we read it out in the paper. And amazingly, everybody was quiet. They were helping. And so I hadn't believed in this at all. But there it was, helping me. And so I found that if I learned a very simple method, I could change my clinic from a noisy, aggressive place to a quiet place.
Now, as you yourself mentioned, you yourself didn't believe in acupuncture to begin with, especially considering your own background in mainstream medicine. You're a psychiatrist, you've done your MD. What really drew you to acupuncture?
In fact, it worked. The theory in the books we have wasn't very good. It rather looked magical. And I'm used to Western medicine, used to things that hurt, things that have side effects, things that are complex, and this was not that way. Originally, acupuncture was done very simply, and we didn't have any fancy things. We used to put a little wire on the needle, and we thought that the electricity would make it better. One day the electricity broke, the machine broke, and we almost said, no, we can't do it. But then we tried. Patients used to come in twice a day, morning and night. So we did this. That night nobody came. So I thought, well, we failed. The next day they said they slept better, it lasted longer, it helped my craving, things they hadn't said for a year. It's a remarkable difference. Without the electricity it worked better. And this was very easy to teach my staff. It's easier than drawing blood, because you just put a little tiny pin. So we're able to teach a lot of people. And I had very rough patients. They had weapons and they had a lot of things. And they were always a big crowd. We would take in 250 people every day we did intake. And
you did find that the people did become calmer and responded very well. Now, Suneel ji, I want to ask you, जब हम इस तरह के acupuncture की बात कर रहे हैं, जिस तरह का आप लोग करते हैं, this is specifically to the ear, पूरी body का acupuncture नहीं है, इसकी क्या खासियत है?
जैसे इन्होंने जब हम ये इसको कहते हैं कि फर्स्ट कांटेक्ट पॉइंट पर एक्यूपंक्चर का इस्तेमाल करना, क्योंकि जब पेशेंट पहली बार आ रहा है तो वो इतना तैयार नहीं होता कि आप बॉडी एक्यूपंक्चर कर पाए। तो कान क्योंकि एक्सेसिबल है, इन्होंने इसलिए इसका इस्तेमाल किया। और दूसरा ये कि यहाँ पर पेनलेस है, कि इसमें पेन नहीं होता बिल्कुल भी, जैसा एक मिथ है, सोच है कि एक्यूपंक्चर बहुत दर्द होता है, तो वो एक कान एक मकसद बना। और मैं समझता हूँ ईयर एक्यूपंक्चर जो है आसान है पहुँचना, और सबसे बड़ी बात कि एज ए सोशल वर्कर मैं अपना टच जो है वो जो ट्रस्ट है वो कम्युनिकेट कर पाता हूँ। तो ये मेरे को इसमें बड़ी मदद मिली कि जो एक्यूपंक्चर है, खासतौर से अगर हम फर्स्ट पॉइंट पर इरिस्पेक्टिव ऑफ कि वो क्या एडिक्शन है उसका, क्या प्रॉब्लम है उसका, वो उसके आसपास के बावजूद भी हम उसको इलाज कर सकते हैं, बिना चाहे वो झूठ बोले तो भी हम उसका इलाज कर सकते हैं। ये
अच्छा, इससे कोई फर्क नहीं पड़ता है?
नहीं, क्योंकि यहाँ कॉमन आप ये सबको एक जैसा ही इलाज दे रहे हैं आप, और ये डायग्नोसिस से पहले का है।
अच्छा, ये बात आपने कही कि इन नीडल्स से दर्द नहीं होता, लेकिन जब नीडल्स का साइज देखा जाए, कोई भी नीडल हो तो इंसान थोड़ा सा तो डर ही जाता है। तो हाउ डू यू कन्विंस समबडी टू कम एंड गेट दिस ट्रीटमेंट डन?
पहली चीज जो है वो ये कि जब व्यक्ति देखते हैं दूसरे को, तो दूसरे को देखकर, क्योंकि पहली बार में कोई तैयार नहीं होता, क्योंकि हमारे कहीं ना कहीं बचपन के अनुभव जो होते हैं वो चाहे डॉक्टर के द्वारा हो या माँ के द्वारा हमें एक मैसेज मिला होता है कि बेटे दवा खा ले कड़वी, नहीं तो इंजेक्शन मिलेगा। तो वो कहीं ना कहीं एक डर और एक डॉक्टर के प्रति हमारा जो रुझान है वो बड़ा नेगेटिव कर देता है। इसीलिए शायद हम जब हम परेशान भी होते हैं, मेडिकली कोई हमें इलाज भी चाहिए, तो भी हम आमतौर पर इतनी आसानी से डॉक्टर के पास नहीं जाते, क्योंकि संबंध हमारे बहुत अच्छे नहीं रहे। तो वो पहले तो हम इस पर काम करते हैं कि उनके जो अनुभव हैं उनके बचपन के या और किसी तरह के, उनको जवाब दे सकें। दूसरा ये कि जब ये ग्रुप में होता है तो ग्रुप में क्या होता है कि एक व्यक्ति को लगता है तो वो दूसरा अपने आप देखना शुरू कर देते हैं और सभी मानते हैं। शुरुआत तो हम इसकी शुरुआत जो है कभी भी कंपल्सरी रूप में नहीं करते, वॉलंटरली होता है। जो व्यक्ति लेना चाहे वो ले सकता है, नहीं तो आराम से बैठे वो, क्योंकि इसी तरह के ग्रुप में सारे प्रोसेस होता है।
Dr. Smith, this treatment, normally do you do it as a group or can it be done as an individual treatment as well?
Well, it can be done individually, but the results of all acupuncture are better in a group. The larger the group, the better.
Why do you do that? Does it inspire the group to draw inspiration from each other, or is there any other reason?
Not really. We often do a group where people can see each other, but in the prisons in Florida, they did them in row style, so they couldn't see each other. They actually preferred that because they were able to get more people with treatment. You can say it's a sharing of the energy process. All I know is that people who really want to feel better because they feel very bad, they like it in a group. We used to treat AIDS patients. They would donate the apartment and we would come in, so they would design the treatment. And even when we did body points and beds, they would move all the beds into 1 or 2 rooms. No privacy, but they found it was better. This is their choice. One reason of starting with addicts is addicts are kind of desperate if you can help them. So they will help you, tell you what it is, and be very mad if you don't do it that way. That's a good way to begin. And then we found that with normal people, with staff stress, with vice presidents in the hospital, this works just as well. The hospital used to ask me to treat the inspectors. They would come in for their final discussion, and then we would treat all 8 of them. And I did that for several years because it made them feel more of a team, more relaxed, and a lot of pressures on inspection. And the hospital liked a good inspection. So here we were doing something not in any book that the inspectors liked. We never asked for that. One day people said, well, why don't you do this? And this is very good for working people who have different supervisors. They have to balance a lot of ideas and not be overwhelmed by one thing or another. And your mind becomes quiet. Now you own it again. You're not remembering 10 things. You're able to
center yourself somewhere?
Yes, indeed.
Yeah.
And you're able to listen. Even addiction treatment, you listen. Anybody can talk. Listening means you take it in, and that's more important. And in any management business, you need to listen. Managers gain by listening, and by being calm and reflective. And when they talk, they're not gaining, it's just that's the output.
True, that's very true. Sunil, what Dr. Smith said is very interesting, that on the one hand it calms, this treatment calms people down. तो जो calming effect है, is that the detox effect, or is that a separate thing altogether, or is this just a side effect of acupuncture?
नहीं, कामिंग इफेक्ट, क्योंकि जब हम कहीं भी क्लिनिक में या कहीं भी जाते हैं, क्योंकि अब ये क्लिनिक से परे ये बात आ गई है, तो हमारे अंदर कहीं ना कहीं एक अंदर बेचैनी बनी रहती है, और अगर बेचैनी तो वही एक रुकावट बनती है किसी डॉक्टर के पास जाने में, किसी काउंसलर के पास जाने में, या किसी टीम वर्क के लिए। क्योंकि जब भी हम टीम वर्क की भी बात, आज हम लोगों ने कोयम्बटूर में भी लेटेस्ट जो है, हम लोगों ने कॉर्पोरेट सेक्टर में टीम वर्क के लिए इस AcuDetox को इस्तेमाल किया, तो वहाँ
Which has nothing to do with addiction of any kind.
नहीं, ये वेलबींग के लिए है, और क्योंकि काम हम सभी होना चाहते हैं अंदर से, और इसकी जो कामनेस है वो है अंदर से बाहर की तरफ। जितनी भी चीजें हम चाहे चाय पीते हैं तो बाहर से अंदर की तरफ है वो, सजेशन कोई हमें देता है तो बाहर से अंदर की तरफ है, कोई हम सुंदर चीज देखते हैं तो हम देख करके उसको हम अंदर बाहर से अंदर जाता है, मगर ये चीज ऐसी है जिसमें अंदर से बाहर अगर हम काम हो गए तो, और ये इनवॉलंटरली है, यानी कि इसके अंदर मुझे कुछ करना नहीं होता, केवल मुझे लगाया और बैठ गया, मैं 20 मिनट बैठा तो वो 20 मिनट जो है मेरे को सेटल करने में मदद करता है।
अच्छा, 20 मिनट में एक इंसान सेटल तो हो गया, काम हो गया, शांत हो गया, तो उसके बाद जब नीडल्स निकाल दी जाती है तो ये असर कितनी देर रहता है?
I think you will be able to answer it better. Yeah.
Dr. Smith,
Well, I mean,
how long does this effect last?
Yeah.
Well, it depends. This is like a suggestion to your body. So if you read an affirmation, how long does it last? Maybe you're not ready, it lasts half a day. If you're ready, a week. If this really fits you, 6 months. It depends. It's not an injection like a drug, because then it doesn't last long, so you buy another one. This is an affirmation. Oh, I like this. After a week, I remember it. I don't need to say it again.
But by and large, for an addict, how long does the treatment last?
Depends what they're addicted to.
Right.
You talked about smoking. If people smoke a lot, this will, we've done this to doctors in meetings who hate the idea, and the nurse says, why don't you try? The next morning, the doctors, I'm changed. I stopped. And they didn't stop right away. They typically wait until 6 or 8 hours later. What you're doing is you're helping the body do something. So it doesn't take orders from a chemical. It has its own rhythm. If I help a person in the morning, treat them in the morning, it helps them sleep at night.
But there are a lot of addicts in particular who have issues with trying to get to sleep. That has been one of the major things. So uske liye, do you have something that they can do on their own? Because every time coming and getting treatment done is not easy. So is there something that you give them subsequently as well, or as support?
No, the acupuncture just for sleeping is fine.
Right. So can a patient do acupuncture on himself? Is that possible?
Well, some like to try. It's a hard thing with the mirror and all that, especially being nervous when you need it. But it's a simple thing. Certainly if you're with someone else, it's possible. This is very much like ear piercing. You can be new ear piercing for yourself, but you don't like to.
But do you think instead of acupuncture, which of course would be a specialized skill, can people give acupressure to themselves or massage certain points?
Sure.
Does that help?
Well, the needle is a replacement for the hand.
Right.
So you can do better just with your hand. The problem is you're going to do this for about 30 minutes, whereas the needle can be quickly. So I can take a group And in New York we have a different regulation. I can train all my staff. This is simple, but drawing blood is much harder to do. And putting these needles in is very easy. It's very safe, it's in person. We don't have a doctor do ear piercing for women who have ears pierced.
Yeah. I suppose when you pierce your ears, that is more kind of incisive because it goes through. This is only on the skin.
On the surface, the surface of the skin. And the size of this needle is just 0.2 mm.
You have needles with you. We'd like
Yeah.
to see a sample of it.
Now these are fine needles,
These are pretty fine.
and they are not strong. They're too sharp.
They're quite flexible.
Sure.
Yes. Okay.
Because you're not digging. When I use Western medicine, I want to dig a hole and make a tunnel and all this. I put this needle in just a millimeter or so in the skin. You can have children pull them out, and they just touch it and it comes out. And these are all sterilized needles.
And are these one-time use needles, or do you use them several
Use
times?
only one time.
Yeah, that's a system.
How well qualified do you need to be to learn this?
The issue of supervision and setting. This treatment helps people participate in the treatment. It helps them participate in group. It's not changing their life. It's helping them to change their own life. So I trained about 8,000 people.
8,000 people?
Oh yeah, from all countries, and that's how I knew where to go. Somebody came to us and I went out there. But this is simple, so you have a supervisor. You say, okay, I have a doctor or an acupuncturist as a supervisor. They watch what you're doing. You're doing something. Counselors or therapists, they like their job. They don't want to become an acupuncturist. We're doing this to make the counseling easier.
So if somebody has an addict in the family, do you think the person can learn acupuncture for this purpose?
Again, this is part of the treatment. If I'm working with the family's been arguing for years, be harder, be softer, and it's very easy to make the family be in harmony and work together. But that doesn't solve the basic issue. That means they're more calm and they can listen. But the counseling and the therapy is very important. I made it possible. If you have a couple that hasn't talked in years, it's very hard for the counselor.
That's true.
So when people are calm and they can listen, now the counselor can begin. So it may take 8 months, it may take a year, because he has to talk and they listen. Then they have to talk to themselves. The acupuncture is just the beginning. It's the key that opens a door.
What you said is very true. This is a key that opens a door, and a door to the inner world for the patient or whoever accepts this treatment. We'll talk more about it, but right now we take a short break. We'll be right back. वेलकम बैक। आज के प्रोग्राम में हम डॉक्टर स्मिथ और सुनील वात्स्यायन जी से बातचीत कर रहे हैं डिटॉक्सिफिकेशन और डी एडिक्शन के बारे में, और वो भी एक्यूपंक्चर के जरिए। सुनील जी, ब्रेक में जाने से पहले डॉक्टर स्मिथ हमको बता रहे थे कि कैसे वेस्ट में काउंसलिंग बहुत ज़रूरी है पूरी फैमिली की जब डी एडिक्शन की बात हो। हिंदुस्तान में क्या सिनारियो है?
देखिए, यहाँ भी क्योंकि जो एक्यूपंक्चर है और खासतौर से नाडा प्रोटोकॉल है, ये अपने में ट्रीटमेंट ना होकर के बल्कि ये एडजंक्ट ट्रीटमेंट है, यानी कि ये और ट्रीटमेंट्स का रिप्लेसमेंट नहीं है, अल्टरनेट नहीं है। तो तो जो डिटॉक्सिफिकेशन के लिए दवाइयाँ चाहिए वो अपनी जगह चाहिए।
तो मतलब जैसे वो मेथाडोन वो सब देते हैं,
मेथाडोन की जरूरत नहीं है, मगर ये कि अगर मेथाडोन कोई क्लिनिक का मेथाडोन पर बेस्ड है तो वो अपनी जगह है। हमारे यहाँ मेथाडोन बड़ा सुपरवाइज उसमें सिचुएशन में एम्स वगैरह में ही इसकी अवेलेबिलिटी है, मगर जो दूसरे डी एडिक्शन के जितने भी प्रोसेस हैं, चाहे वो होम्योपैथी हो, नेचुरोपैथी हो, वो सब प्रोसेस अपनी जगह होंगे। मगर इस ट्रीटमेंट से जब हम उसमें ऐड कर लेते हैं, जो आप एग्जिस्टिंग जो भी जितना भी इंफ्रास्ट्रक्चर चल रहा है आपका, उसी के अंदर इसमें अगर ऐड कर देते हैं तो थिंग्स स्टार्ट मूविंग मच बेटर। तो यानी कि हम, क्योंकि हमारे जब मैं नव ज्योति का मैं संस्था का मैं डायरेक्टर था मैं, तो उस समय जो है इस मैंने देखा कि बहुत सारे मेरे सामने चैलेंजेस थे। चैलेंजेस क्या थे कि बहुत सारे लोग मेरे पास नहीं आ पाते थे, क्योंकि मेरा काउंसलर ये कहता था कि ये झूठ बोल रहा है, अभी ये नशा नहीं बता रहा कि कौन सा इलाज मैं नशा लेता हूं मैं। इसके घर वाले कहते हैं कि इसको समस्या है, मगर ये कहता है मुझे समस्या नहीं है। तो ये बड़े चले, और वो चाहते थे कि ऐसे तरीका हो कि जिसमें मैं इसको बताऊं भी नहीं और इलाज हो जाए। ये आप अक्सर ये बात सुनने को मिलती है।
बिल्कुल।
तो ये भी चीजें ये मेरे सामने चैलेंजेस थे एज ए काउंसलर भी, कि क्या मैं उन लोगों तक अप्रोच नहीं कर पाऊंगा जो अपना नशे के बारे में नहीं बताना चाहते, एडिक्शन झूठ बोल रहे हैं, या अपना हिस्ट्री नहीं बताना चाहते। तो ये एक ऐसा पॉइंट मिला कि जब मैं, जो भी लोग आ रहे हैं इरिस्पेक्टिव ऑफ देयर एडिक्शन, कि उनका डायग्नोसिस नहीं भी हुआ है तो भी हम नाडा प्रोटोकॉल का इस्तेमाल कर सकते हैं, चाहे वो ड्रॉपिंग सेंटर के लेवल पे हो, ओपीडी के लेवल पे हो, या कैंप के लेवल पे हो। क्योंकि बहुत से लोग ऐसे हैं जो कि एडिक्शन की स्थिति जब पहुंच जाती है, ऐसी जब बिल्कुल बहुत खराब स्थिति पहुंच जाती है, तब जाके लोगों को, तब तो लोगों को पता लग जाता है। मगर असली चैलेंज है कि हम उन लोगों को जो कि यूजर्स हैं, अभी शुरू किया है, और अपनी समस्याओं को आकर के बता सके, काउंसलर को कैंप में जोड़ सके। तो ये वेलबींग के लिए अभी इस्तेमाल कर रहे हैं, यानी कि इसको कैंप में लगाइए। जब अंदर से मैं स्ट्रेंथ पाता हूँ, अंदर से कामनेस आ जाती है, तो मैं मदद मांग पाता हूँ। क्योंकि जो सबसे बड़ी हमारे यहाँ समस्या है वो है मदद मांगने की। व्यक्ति 5 साल लगा देता है। हम लोगों ने बॉर्डर सिक्योरिटी फोर्स के साथ काम किया, उसमें देखा कि व्यक्ति जो पास में व्यक्ति है या सुपरवाइजर, उससे मदद नहीं मांग रहा, काफी दूर फोन पे मदद मांग रहा है। क्योंकि कई बार क्या होता है कि हम पेशेंट बनना नहीं चाहते, फिर भी मैं इलाज चाहता हूँ, क्योंकि पेशेंट बनने में एक बहुत बड़ी वो चाहिए, तो इलनेस का सवाल जुड़ जाता है।
आई थिंक टू एक्सेप्ट दैट ऑल दिस इज एन इलनेस,
वो अपने में एक बहुत टाइम लगेगा।
किसी को अगर हार्ट की ट्रबल है, कोई और ट्रबल है, उसको वो मान लेता है।
नेशनल हाउस होल्ड सर्वे हुआ मिनिस्ट्री ऑफ सोशल जस्टिस का एंड यूएनओडीसीपी का, तो उसमें पाया गया कि तकरीबन 5 साल लग जाते हैं ऑनसेट ऑफ द प्रॉब्लम और रिपोर्टिंग टू द क्लिनिक। तो 5 साल, इसका मतलब क्या हुआ कि शुड वी वेट फॉर दैट पर्सन टू कम? क्योंकि अगर मैंने क्लिनिक खोला है तो मैं केवल ये चाह रहा हूं कि लोग आएंगे तो मैं इलाज करूंगा, अगर नहीं आएंगे तो मैं नहीं करूंगा। मगर हमें उस गैप को दूर करना है। एक्यूपंक्चर उस गैप को दूर करने में मदद करता है।
What you said is very interesting, Suneel ji. I want to talk to you about this, Dr. Smith, that you know, a lot of people, when they get into any kind of substance abuse, even something as simple as tobacco or smoking, they assume that they are never going to get addicted and that they are in control, isn't it? So at what point do you think somebody should intervene and get rid of the habit? We know, for example, that with the first puff you get addicted to smoking. When it comes to drinking, a lot of people think that up to 2 drinks a day and I'm okay. When that becomes from 2 to half a bottle, nobody knows. And the same is true also for drugs. One single ingestion of the drug in any form and you're done.
No,
Isn't that true?
No. When people go to hospital for surgery,
Right.
they give them narcotics. The same narcotics in the
Yeah, but that's in a controlled situation.
What's controlled? You take the narcotic for pain, but you also find this narcotic makes social situations easier. It makes depression go away. So it tempts you. And what I tell people, I say, look, if you take one drink or one whatever, fine. If when your life is going worse, you take more, that's it. You need to change.
So this process of de-addiction is actually a longer and a more comprehensive process, isn't it?
Yes.
There's more counseling involved, to help the person overcome the weakness in the first place rather than the addiction.
Yes, the issue with addiction has to do with price and pressure, but the actual weakness is something that people have, and the counseling is part, but the counseling again helps them help themselves. You tell them something, it has to mean something to them. Counselor's not going to be everywhere. And addiction is a way of avoiding things. So counseling can't fix that. You have to be braver and more clear. And all people growing up, I'm a child, I have an addiction, I get over that. I'm braver. I have a weakness, I'm embarrassed. All those are addictive things that people get over. That's part of growing up. That's part of continuing to be grown up. So the acupuncture gives you a fresh start. Like a fresh sleep, you're able to be more optimistic and more open when you wake up from a fresh sleep. This is the same way we're going to give you your mind and your feelings back again.
In India, it is slightly different because in India there is this great sense of family. So it is not the individual so much as the family being involved in a person. So I suppose in that sense the situation here is different. So when you counsel an addict, do you counsel the family?
Of course. It is the family who comes first, not the addict himself. The person who has a problem. And but they are desperate because they are the people who are facing real problem. And they want a solution in terms of if that person should come over here voluntarily or involuntarily. So they just want, like, which is not the legal case, like legally you can't take a person involuntarily in your clinic. But they are ready to do everything. So it means what we do, like when the person is not ready to talk or when the person is not ready to come to clinic, we start working with the families. The family member is important, and then they need AcuDetox. They can be good because they become a sort of a part of a problem rather than part of the solution. So since the initiative is coming from them, so let us work with them. So we always, and we call it is a family disease. When it is an individual disease at a place when we are talking in terms of addiction, but it becomes a family dependence, because now the family is depending on the person, because they will be happy if the person is okay, if he is off the drugs. So then we communicate the same thing, that they can still have a right to be happy even if the person is in addiction.
In fact, आपने ये जो बात कही, right to be happy, ये आपकी जो पूरा healing system है, इसमें ये बहुत important है. The right to dignity.
Acupuncture helps that because even though it's done in a group, it helps each person in a different way. And as you were saying before, I don't know much about you, so I'm going to help you. I'm going to give you a gift of healing process, so you will feel better in your own world. I go to a hospital, people have different issues. I don't know what they are. And if they're very confused, they don't know how to tell me. So if I help them to a certain degree, they communicate better, they listen better.
So it means this AcuDetox helps a person, like that's why we call it is a waiting room treatment. And he never call it a treatment, but it is more as a gift. Because in treatment you need a diagnosis first. But for these things, for gift, you don't need anything, you just offer it. Like you come and get it, and then you are ready for therapy or other work.
But isn't that wonderful? So if anybody has any kind of doubt, they can just walk in.
Even if they don't have the doubt, they just feel like having, it is just like having a glass of water. You feel thirsty and you just ask for it. So one can always, because everybody would like to be settled in self, be more comfortable within himself, and a strength inside, finding his own strength. So that's why it is nada. Nada means nothing. So there is nothing which we are putting in except that needle which has no substance or anything, but it is just helping a person to be comfortable with his own self.
So that means, if, Dr. Smith, if somebody does not have addiction problems, but is caught up with the hurly-burly of life and is just stressed out, one can just approach NADA in India or anywhere else in the world where you operate, and one gets treatment.
Well, certainly, but a lot of times you don't feel bad, you feel good, but this treatment will help you feel better.
Right.
If you work in a pressured day-to-day job, you never really feel relaxed, but it's normal. And so this makes a better quality of normal that people appreciate. I used to feel that. I felt that on weekends. And we had HR people in the hospital. They would have all these staff people get treatment together, because the way staff is worked, they compete with each other. Lower budget, higher budget. All day long, work means competing. In the Western model, only the Christmas party is good, and you have to be drunk. That's ridiculous.
True.
These people work in the same room for 20 years. They ought to like each other. They ought to be able to communicate easily. And with acupuncture, this kind of treatment is very simple. Again, it's a key that opens the door. If my staff likes each other, I should follow that up. And not just do it once a year. This is also language blind.
Right.
So people have different languages. They have one language as a child, another as an adult. Some people feel upset in their child and not in their adult language. I don't know, but I can help you, because we're not doing everything by language. What we do in therapy is we use verbal language for everything. That's too much. You have to talk about everything. Life isn't talking about everything. And so I can do a treatment that takes the burden off language. A lot of therapists who start talking, this person is sick of talking. They don't speak very well, whatever. So I use as a gift. You give a gift of presence and calmness, so you don't feel this burden of too much language. There are a lot of people who try to speak the grown-up language, and they're always thinking of other things in another way of speaking.
What you say is extremely profound, Dr. Smith, the process of giving and receiving in silence. And this really is a very spiritual process. But we'll talk more about it after a short break. We'll be right back. Welcome back. Acupuncture के ज़रिए हम addictions से कैसे निजात पा सकते हैं, and how do they help us with a general sense of well-being, इसके बारे में हम आज बात कर रहे हैं डॉक्टर स्मिथ और सुनील वात्स्यायन जी से. Suneel ji, I want to ask you, what is the process, or what are the various steps involved in acupuncture for detox?
As like Dr. Smith has said, like something about like how we can use the same thing starting from the very beginning of all the stages of the addiction treatment and rehabilitation. Starting from when the person is not ready to talk or ready for the treatment. One can only start the same treatment at the drop-in center or OPD level, and the person can come and go back. And even if he is on drugs, there is no issue. And it means there is a total acceptance of the person as a whole without talking that person. Second is once the person is committed and he says that yes, I am ready for the treatment, then it helps in detox as well as in withdrawals treating, but not just alone, but along with other treatments. तो इसमें क्या है कि we can always take care of in the rehabilitation process also. तो ये one can always on demand, because we go not by just as a part of prescription, but it goes by with the demand. Then when it comes when the person is going for the follow-up, there is nothing we have to offer. What we can offer is just counseling or some information or some medical help. But here there is an experience one can always come, and it helps in relapse prevention too. So relapse prevention में भी काम होगा.
This insight is very important because wherever the other treatment is concerned, relapse बहुत जल्दी हो जाता है, उसका chances बहुत high होते हैं.
क्योंकि उसमें क्या है कि आदमी जो ना अपने अंदर कहते हैं कि रिलैप्स जो है जब आदमी शराब का उठाता है उससे पहले उसका विचारों से खेलना शुरू कर देता है.
बिल्कुल.
तो वो विचारों को जो एंटरटेन कर रहा होता है तो बड़ा अपना गिल्ट भी फील करता है, और वो किसी को बताते हुए बड़ा उसको महसूस होता है कि मैंने तो वहां कमिट ये करके आया था मैं, और अब मैं दोबारा उस तरफ जा रहा हूं मैं. जबकि वही टाइम था कि जिस समय अगर वो अपने उसको AcuDetox मिल जाता है तो देन ही कैन बी मोर कंफर्टेबल विद हिज ओन थॉट्स एंड गिल्ट फीलिंग. वहां से वो कंफर्ट हो गया तो देन इट इज इजी टू कम बैक एंड से कि आई मीन थोड़ा सा मुझे खतरा लग रहा है, थोड़ा मुझे डर लग रहा है, तो मैं आई कैन ऑलवेज कम बैक. वो जो कम बैक वाली है तो वहां पर क्या है कि अनकंडीशनल है. अदरवाइज क्या होता है कि टीचर जो है या थेरेपिस्ट यही सोचता है कि मेरा सारी मेहनत बेकार गई, फैमिली यही सोचती है सारी मेहनत बेकार गई.
So there is this sense of judgment.
सेंस ऑफ जजमेंट. तो यहाँ पर उस बैरियर को भी हम ओवरकम कर पाते हैं, क्योंकि मैंने आया एक्यूपंक्चर लगवाया, मैंने कुछ नहीं भी कहा, अंदर प्रोसेस चल रहा था, तो भी मैं एक्सेप्टेड हूँ और मेरे को किसी ने जजमेंट पास नहीं की.
And it is okay to weaken.
Yeah.
That is only a natural process.
I have a right to fail. मेरे को अधिकार है कि मैं फेल हो सकता हूँ, मैं मिस्टेक कर सकता हूँ. लगता है मुझे समाज हमारा जो है गलती करने का अधिकार हमें नहीं देता, जबकि हम कहते हैं कि हम सीखते गलतियों से ही है.
बिल्कुल.
तो ये अधिकार अगर हम लें तो मैं समझता हूँ कि वी कैन ऑलवेज, बहुत से लोगों को हम अपने उसमें परिवार में ले सकते हैं, जोड़ सकते हैं, और शायद बहुत सारी सुसाइड्स को हम रोक सकते हैं कि जहां पर लोग अपने को राइट टू फेल होने का अधिकार दे सके.
If one wants to access the website, one goes to NADA India.
AcuDetoxIndia.com.
AcuDetoxIndia.com.
और जो AcuDetox.com है वो अमेरिकन यूएस नाडा यूएस की ऑर्गेनाइजेशन है.
Dr. Smith, you have taken this beautiful therapy to various parts of the world. You started in America, but now it's available in Africa and other countries. Has the experience been different in every country?
It's different in every block,
I see.
every family, every situation, because the key opens a different door. Most of these treatments are commanding the doctor, I control. That no addict, no depressed person wants that. They all try to help themselves. They don't brag about it. I tried to stop this morning and I didn't. I don't tell my family. So initially they don't have to talk because they don't know what to say. And it's like asking a man in a wheelchair to walk. Well, walk. You can't do that. You give them a gift of enthusiasm, patience, family members, and then maybe they can do a little bit. But if the person has a weakness and I demand something, that's no good. They say, well, the Bible's more friendly than my father. And your father may mean well, but he doesn't know how to be friendly.
Right.
So we have a key that opens the door, that allows him to sleep better, be more humble, and allows the time to stretch. Addicts say, oh, what's now? You want the time to stretch out. Judgment, worry, memories, mold out, whatever. So the person is not afraid of today. Addicts are afraid of today. Yesterday was lousy. I think today's going to be lousy too. Well, I want to give them an ability to feel, you feel better when you wake up in the morning than when you went to sleep. This is a gift. It comes from nature. We're going to repeat the same thing. And you're going to feel that you can be better. You're not broken. I've been drinking for 10 years. I must be broken. I'll just fake it. No, not at all. We have a lot of people with very long history. the key still opens the door. And they may take longer in therapy, longer in rehab, but their alertness and their ability to help others and listen right from the first day. So people are impressed. I didn't know I was open-minded. I tried and I failed. You just try and make it easier to try. Giving you a little heel on the baggage so you can roll it easier. That doesn't change everything, but it changes the thing. As young people try to walk, they fail over and over and over.
But they keep trying.
That's how they learn to walk. If you're willing to fail, you learn. They get older in social relations, they don't know how to fail, and they don't know what others will say.
I suppose the difference is that when you're a little child, when you fall and you rise again, you don't know the definition or you don't understand what failure is. It's just a process. I suppose as you grow older, you suddenly are burdened by the thought or the understanding of what failure is. Is that true?
We are built to try, and that's the way you learn. The way you talk and 1,000 things. But then you learn adult lessons, grown-up lessons, superior culture lessons that make you self-conscious and not want to do something. I'm going to take away those lessons. But you are still there. Acupuncture is not brainwashing. It's like a good night's sleep. I'm finding the you that was already there. So what people have, we have client who says, I was 10 years old. I was just sitting on the hill thinking about things. He did that. He had that memory. I didn't. As opposed to a drug that pretends to do that. Clients don't like drugs that they can pretend like that.
सुनील जी, इसके बारे में मैं आपसे पूछना चाहती हूँ कि नॉर्मली बहुत सारी जो ऑल्टरनेट थेरेपीज हैं उसका बेसिस ही ये है दैट व्हेन यू हील वन लेयर द नेक्स्ट लेयर कम्स टू द फोर एंड दैट नीड्स टू बी हील्ड वैसे you go through layers and layers of the psyche. So when you start this acupuncture process, do you see that happening in your patients?
सबसे बड़ी बात ये कि it happens, it is done voluntarily, but it happens involuntarily.
Absolutely.
It means the process is not to be directed by anybody from outside. It happens its own. So
Yes.
ये अपने आप होती है, अंदर से स्व में जाते हैं आदमी. स्वस्थ की स्पेलिंग है स्व में जो स्थित हुआ वो स्वस्थ कहलाया. तो ये it helps you to settle yourself in yourself.
तो मतलब ये कि जो वो एक वो पॉइंट जहाँ से आपकी
स्टेजेस ऑफ एडिक्शन का ट्रीटमेंट है वो अपनी जगह वहीं रहते हैं, उतने ही पूरे रहते हैं. मगर ये कि उस पूरे प्रोसेस को हाउ बेस्ट वन कैन एक्टिव उसको फैसिलिटेट कैसे करता है, वो AcuDetox में जब आप ऐड कर देते हैं, यू आर एडिंग ए सॉर्ट ऑफ वैल्यू टू the whole treatment process itself.
Absolutely. यानी कि जिस पॉइंट से आपकी एडिक्शन शुरू हुई उससे पहले की भी जो आपकी इश्यूज हैं वो इसमें सॉल्व होते गए.
उसमें से आप रिजॉल्व करने में आपको मदद मिलती है. ये एक बड़ा इंपॉर्टेंट शब्द है कि इट हेल्प्स यू टू हेल्प योरसेल्फ. कि सोशल वर्क का काउंसलर का भी यही मकसद है कि वो अपनी स्वयं मदद कर सके, डिपेंडेंसी किसी और पे ना रहे, इवन थेरेपिस्ट पे भी ना रहे. तो वो स्थिति वहां पर लाई जा सकती है. और मैं समझता हूँ कि AcuDetox जो है किसी भी ट्रीटमेंट प्रोग्राम का, चाहे वो जेल में काम कर रहे हैं, पुलिस के साथ काम कर रहे हों या हम कहीं टीम वर्क के लिए भी काम कर रहे हो, सो दिस वर्क्स एज ए फाउंडेशन फॉर द व्हाट वी इंटेंड टू डू. क्या हम करना जा रहे हैं उसके एक फाउंडेशन का काम करता है.
तो आपने जैसे पुलिस की बात की, नॉर्मली भी कहते पुलिस वाले बहुत गुस्से वाले होते हैं, उनसे सब डरते हैं. सो डू यू थिंक दिस ट्रीटमेंट हेल्प्स इन कामिंग देम डाउन एंड इन देयर वर्क एटीट्यूड एंड हाउ दे बिहेव विद सिविलियंस? इट हेल्प्स.
ये सेडेशन की तरह काम नहीं करता कि क्योंकि सेडेशन में तो एकदम हमने क्या यही प्रश्न एक इंस्पेक्टर जनरल है उन्होंने पूछा जो BSF में पहले थे कि क्या परफॉर्मेंस जो है उससे कम हो जाएगी, अलर्टनेस बढ़ जाती है.
अच्छा.
और सबसे बड़ी बात कि अलर्टनेस बढ़ गई. और मैं अगर मैं इफ आई एम क्लियर अबाउट माय ओन पर्सपेक्टिव तो मैं आई विल रिस्पॉन्ड टू द सिचुएशन बेटर। तो क्या होता है कि जब मैं अंदर से ही उलझा हुआ हूँ तो बाहर तो मैं सुलझा नहीं पाऊंगा। और वही एक दिक्कत मैं समझता हूँ कि पुलिस हो या पब्लिक डीलिंग जहां भी हो रही है, वहां यही होता है कि वहां सारा फोकस बाहर की तरफ रहता है, अंदर की तरफ ध्यान नहीं जा पाता। जब अंदर चला जाता है तो फिर आसान हो जाता है बाहर के काम को,
और आप वही काम शांति से कर सकते हैं।
वही शांति से, क्योंकि मेरे रिस्पॉन्सिव जो हैं उतना ही और ज्यादा बैलेंस्ड हो जाते हैं। ऐसा नहीं कि वो इम्बैलेंस है, बट ये कि वो कहीं ना कहीं अंदर से जो परेशानी चल रही है, जो अपनी सेल्फ केयर नहीं चल रही है, या जो अपनी अंदर से कहीं ध्यान नहीं जा रहा है, वो ध्यान जा पाता है बिना कुछ करे। जब मैं कहूंगा कि आप अपनी तरफ ध्यान दीजिए तो एकदम ही मैं अपने को छुपाने का डर लगता है मेरे को, कि मैं छुपा लेता हूँ। मैंने किसी से कहा कि भाई आप अपना ध्यान रखो, इसका मतलब कि मैं ध्यान नहीं रख रहा हूँ। सो देयर इज तो मेरे को यहाँ मैं ऑफेंसिव हो जाता हूँ।
बिल्कुल।
तो उससे भी हम अवॉइड कैसे कर सके, तो मैं समझता हूँ पुलिस हो चाहे बॉर्डर सिक्योरिटी फोर्स हो, CISF में भी हम लोगों ने इसका ट्राई कर रहे हैं कि किस तरह से इसको वहां पर इस्तेमाल की जा सके, एंड दिस इज हाउ दे कैन बी।
इन सबके साथ साथ हम जैसे आम आदमी जो है
बिल्कुल
वो भी
इस्तेमाल कर
इसे
सकते हैं,
काम होने के लिए इस्तेमाल कर सकते हैं।
इसमें मैं एक बस ये ऐड करूंगा कि हम लोगों ने मेडिटेशन से भी पहले इसका इस्तेमाल किया, कि प्रेयर मंदिर में जाने से पहले भी अगर हम इसको करते हैं, मस्जिद जाने से भी पहले करते हैं, तो ये मदद करती है, या चर्च में जाने से मदद करती है हमारे को। अगर मेरे अंदर के डिस्कम्फर्ट्स कम हो जाते हैं तो मैं अंदर प्रेयर ज्यादा बेहतर कर पाता हूँ,
That's fantastic. Yeah. That's a beautiful key to end this program on, that this can be used as a key to meditation as well.
Yes.
Dr. Smith, Suneel ji, thank you both very much for being on our program
Thank you
today
very much.
and sharing this information about acupuncture.